Meanwhile, the emergence of 9 COVID-19 positive cases in a single day in Assam's Barak Valley has prompted the authorities to up their ante in combating the deadly virus. Yesterday evening, Silchar MP Rajdeep Roy was seen rounds of meeting which concentrated on facilitating the doctors, nurses and health workers who come in contact with COVID positive patients. Roy held the meetings with Kachar District DC Kirti Jalli, Silchar Medical College Principal Dr. Babul Besbarwa and other senior doctors. Well, the meeting also saw State Health Minister Himanta Biswa Sharma take part in it via video conferencing from Guwahati. Well, the emergency meeting was called after a patient tested positive at the Silchar Medical College and Hospital. And let me tell our viewers that the patient who was reportedly complaining of stomach ache was admitted to the surgery department for appendicitis. Well, a swab sample was also collected and the result of which came in positive for COVID-19. While the patient has been shifted to the hospital's COVID block, the doctors and health staff have been sent into quarantine for a period of 14 days. Well, we were speaking exclusively to Northeast Live. Silchar MP Rajdeep Roy talked of the preparation that have been undertaken to tackle the situation at the end. Listen in.
I must tell you one thing and all. Out of the 3 districts that are here, Kachar, Karimganj, Hailakandi, there are almost more than 1 lakh registered migrants who have registered through the app or through the telephone number that has been made public for the migrants. We are almost having a daily return of around 500 migrants district-wise. So naturally, the positive cases are going to rise. We are ready for it. We have also, as a matter of principle, we have increased the number of investigation testing facility. So naturally, the more the test, the more the positive case will be. We are ready. There is nothing to panic as far as COVID is concerned. Situation is under control, and I hope firmly that government is doing a human service as far as COVID management is concerned, and the people of the Barak Valley are also realizing.
Well, the Silchar MP also talked about the situation that led to calling of the emergency meeting. Listen in.
Yesterday, these positive cases which has come actually came as a normal patient to the medical college emergency dead hour of the night. Early morning around 3 o'clock, this patient came. Patient was in shock. So to treat that patient, to diagnose that patient, there are a lot of junior doctors who were involved in the late hours, and then in the morning the consultant also saw the patient. So we are having almost around 3 or 4 PG students, 3 to 4 interns, to the tune of almost 9 to 10 doctors who will be going for quarantine. But in the meantime, the quarantine facility has been arranged inside the hospital building. So they will be, as because they have already been exposed, they will see the patient for the next 6 days. Today is day 1. So for the next 6 days, this team of 9 doctors will take care of the COVID positive cases.
Any senior doctor among them?
Yes, Dr. Siddhartha Bhattacharya, associate professor, is also in that group to be quarantined.
Also talking to Northeast Live was SMCH Principal Babul Besbarwa, who said that they are ready to handle the situation. Listen in.
As a guardian of Silchar Medical College and Hospital, you have the pressure on you for entire valley. So how you are taking it?
No, we were expecting actually just after the entry of the people from outside the state. We were ready to tackle up the situation already. We were ready and we are ready to accept. We will be ready to accept until and unless the schedule comes. With the stipulation that we also don't know how many people will be coming. We also don't know how many positive test cases we will have to handle. But until and unless there is no other difficulty arises, we are ready to handle any situation of.
All right, our correspondent Bikram Sarkar from Silchar joins me live at the moment. Well, Bikram, one of the high-profile doctor of the valley is sent for quarantine with the rest of the interns. More details.
Yes, Prerna, the matter came into picture because on 21st of May, in the VR, a patient named Khalilur Rahman, whose age is about 45, of Karimganj district. He came and got admitted at Silchar Medical College and Hospital as he complained that he is having a severe stomach pain. So the medical department, they referred him to the surgery department. There, when he went to the surgery department, the associate professor and the specialist surgeon, Dr. Siddharth Bhattacharya, along with the PGs and PG doctors, interns, and the medical staffs, and also the cleaning staff, the ward boys, they went to him and they were diagnosed him. And after the diagnosis, Bhattacharya came to know that he is suffering from appendicitis. But to be in a safer side, as he was showing some of the symptoms of COVID, to be in a safer side, he asked for a swab test. And after 24 hours, when the results comes, it shocked the entire medical facility. So yesterday night till 11:30, a huge big meetings were conducted in which Dr. Hemanta Biswa Sharma also took part, as because this is a protocol and he is the health minister who is keeping keen vigilance in each and every moment and each and every incident, Prerna. So while the meeting was going on with the chief superintendent and the principal of the SMCH, Dr. Babul Bejwara, Silchar's MP, Dr. Rajdeep Roy, administrative departments like DC of Kachar, Kirti Joli, and all other administrative officials from medical facility, from Silchar Medical College and Hospital, and from the administration side, they sat in a meeting. They informed everything through video conferencing to Dr. Hemanta Biswa Sharma, and Dr. Hemanta Biswa Sharma asked them to follow the SOP, and so they are following the protocols. All the entire team was called along with the doctor. They sat and they were decided to send for a quarantine, as because this is a protocol. They got into direct contact with that patient, Khalilur Rahman, Prerna. And also, it's very important to say that while talking to us exclusively, MP Dr. Rajdeep Roy told us that the PG doctors and the interns who were sent to quarantine for 14 days, for another 6 days, they will be attending the patient.
All right, Bikram, since you spoke about that, there was a meeting, with the doctors and health workers before going under quarantine. So tell us what takeaways, what they discussed at the meeting. Any information regarding that?
Yes. As we were outside, we were listening to them. The MP and the principal, even the DC, they called one by one of the teams. Like from the PG department, they first called the PG doctors. They told them that nothing to worry about. Government is with them. It's just like a 14 days holiday. You just keep away from all the things. Be in a safer side. In this very way, they called the nurses, the interns, the cleaners, the ward boy who are working. Actually, we know that the cleaners and the ward boy are also the frontline workers, because whenever the patient comes in first, they used to take care of it. Then the PGs comes, then the doctors comes and diagnoses. So as per the protocol, as per the SOP, standard procedure, they are asked to be in a quarantine for 14 days, Prerna, and nothing to worry about. They are also asked that inform your parents, your family members, that you are going for a 14 days quarantine. Nothing to worry about. Government is with them, and they will take care of each and every necessity that is required in this point of time. Prerna.
Well, Bikram, what about the infrastructure facilities? Is there enough isolation bed as far as the COVID management, is concerned?
Yes, Prerna, it's very important to mention that we'll start from here. Like the department, the surgery department, where in the first case, this Khalilur Rahman was sent. This entire department, they got, apart from Khalilur Rahman, there were 13 more patients, and there were attendants too. So the entire department were turned to containment zone. And now the works increases here also, because along with the 13 other patients from the surgery department and their attendants will get tested. One thing. Second thing is that the species and the interns and the they are sent to the quarantine center that is made in the Silchar Medical College and Hospital, and some were sent to other paid quarantine centers like doctors and some of the PG doctors. They were sent to paid quarantine. And also, when we asked to Dr. Babul Bejwara, the principal of SMCH, he said that Silchar Medical College is having 86 beds so far. And if it's necessary, if the periods call, then they will turn the entire hospital into COVID hospital, especially COVID hospital. Is also in the beginning of this COVID thing, Dr. Himanta Biswa Sharma has already mentioned it, that if the time asks and if the time comes in, then it will definitely turn to a COVID hospital 100%. And also in the other side, there are some few more hospitals like Assam civil hospitals. It is also a COVID hospital. If necessary, if the seats exceeds, the number exceeds the seats, then they can also be treated there in the other two hospitals. And regarding the quarantine centers, information we have got that NIT is also, Silchar NIT is also getting to get turned into a quarantine center. Many of the institutions are getting turned into quarantine centers. Hotels are already been taken. Lodges are only been taken. But there are few hotels, those who have denied to turn their hotel into quarantine center. That is an internal matter. The investigation will go on why they have not done. But maximum of the hotels and lodges and institutions, already it has been talked, they will turn into quarantine centers. And also, as per the Health Minister, Dr. Himanta Biswa Sharma Prerna, now it's time for the socio organizations and the NGOs also, they will get the help from the government, that they also need to come forward for preparing a new health quarantine centers, as because we don't have, Barak Valley have ample of space left out. Prerna.